Hi, Don here. Welcome to Podiatry Practice Mastery, where I'm helping you bring your practice to the $1,000,000 mark and beyond. This is a recording going over the patients that were in the office on a Tuesday. I had an interesting experience. I had the first time a patient, he came in for one Shockwave many months ago, and then he subsequently went onto Amazon and he bought a Shockwave machine. He called it a Shockwave machine. He paid $1,200 for it. Now, I don't know if anyone else, if this has happened to you before, it might be more of a trend. And he said he bought a Shockwave. And it's funny, I looked on Amazon, I looked at the machine that he had, and it looked very similar to the EPAT or the Curomedics device that we have. So just something to consider is that our patients might be going on and thinking they're getting a real Shockwave machine, and they may or may not. I really don't know. I have not talked to the rep yet to see how does that correlate. I doubt it because I think ours is like a lot more expensive than the $1,200 machine, but it seems like, and I'm sure they probably don't know how to use it because he's been using it and he hasn't been seeing any results. And so it's an additional step for me to have to see him and then explain to him, well, why is my Shockwave different than the $1,200 Shockwave, versus just saying the price and arguing with him. I really can't. So this is a new experience for me dealing with this. Okay, let's go into the office. A 61-year-old patient. He had a couple of issues going on. He had on his foot. He had two warts. They've been there for years. He developed he had lichen planus in his mouth. He had been using chronic steroids, and then he developed, I think it's called leukonychia or something like that. Not nychia, but that wasn't a nail thing, but it was like he had some type of a reaction in his mouth where they were wanting to use an antiviral agent like an Aldera in his mouth. And he was wondering if by treating the virus in the wart, it would take care of this whole like superimposed viral infection in his mouth. I don't know. I asked the rep, but I am treating his wart. So we did a Swift number 1 out of 4. Now this gentleman also, what he really came in for is he came in for a bulbous Achilles tendon. And I get this question frequently. The patient said, I'm going to go on vacation in a few weeks. Should I just wait till I go on vacation, or should I start now? I tend to recommend patients, the quicker you get to the start line, the quicker you can get better. So the quicker they start, the better. Even though there's a little gap in between, I think it's better to start quicker so you can see the results, because the results take 6 weeks. If you delay like 3 or 4 weeks, you're just going to delay in the recovery. So I always say try to get to the start line quick. So I'm going to see him back in a couple of days, and we're going to start that Shockwave. So he's going to be doing 6 sessions of Shockwave for the Achilles. Next patient was a 38-year-old. This is a female. She was seen before for her flat feet. She had previously had orthotics, so I scanned her for a new pair of orthotics. Office visit for both of those as well. Next was a 21-year-old. She is a follow-up before a puncture wound. She stepped in a nail. Tetanus is fine. She was on antibiotics. Now she's having a difficulty bending her toes, and her toes hurt when she bends them. So I did give her some manual exercises, and I set her up for physical therapy to work on range of motion, and if it continues to get worse, I talked to her about doing an MRI. I'm going to see her back in 2 months. Usually with PT, it's usually 6 weeks of PT, and then I will see them back usually at 2 months, because usually it takes 2 weeks to get into PT. Next patient was a nail sample. 40-year-old came in for a nail sample, and then I had them get my fungal nail kit. That is it usually includes biotin, a UV light, and a shoe spray, and it's all written on my fungal treatment sheet. If you want that, shoot me an email, don@podiatrypracticemastery.com. I'm happy to send that over your way. Next was a patient. He had a scar. So he had a puncture wound, or actually I think it was a motorcycle accident like 40 years ago. And initially for this really bad scar, I did laser treatment. I find that laser sometimes helps it, and so it helped the majority of it, but there's one little portion that kind of fissures and is painful, and he actually asked me about excising the fissure, and I don't think it would really work that well. And then he asked about like doing a graft, and I don't do a graft. I know there's another doctor around. He does like a rotational flap that he could potentially do, so I sent him over for a second opinion for that. That's not something that I that I do. Next was a patient, a 33-year-old. This is a soccer player, young man, really, really bad equinus bilaterally. I think that's the cause of a lot of his issues. He has right arch pain and plantar fascial pain. Did x-ray, did ultrasound, and he's going to get set up for 6 sessions of Shockwave. But I think a big component is going to be the loosening of the calf, so he's going to do foam rolling, morning stretch, and he got a night splint as well, a stretch splint. Next patient was a patient, 19-year-old. He had a recurrence of his ingrown toenail with a granuloma. Potentially, I didn't take enough out of the edge. I find sometimes when it swells up along the edge, it can recreate that granuloma. Or if there's a really bad granuloma, it just kind of happens again. So I took out a little bit more nail on the side there. Next patient came in he had a superficial white onychomycosis. I was able to scrape it down. So I just recommended Formula 7 for him, for that patient. Next patient was a 78-year-old gentleman that bought his own EPAT machine that I told you about. So he wants, he's going to try his own thing and see how he does. And if it doesn't get better, he'll come back in for our Shockwave, which you can't buy on Amazon. Next was a 35-year-old. This is a patient that had concern for cuboid pain. He is a runner, runs a couple times a week. Phys ed teacher, had pain around the cuboid region. I asked him how he learned about cuboid. He Googled it. Did not have a stress fracture. I think it was more from going to wearing shoes to trying to grass run and doing sprints in the grass. And so I think it will calm down on its own. Next patient was, this is a little girl. She's 13. She had a subungual hematoma. And I trimmed back the nail, and I'm going to let a new nail kind of grow back. And I discussed with her about doing Cariflex, just have it look good during the summer. Next patient was a 20-year-old guy that he had a really bad ankle sprain, did a left ankle injection, didn't really get better, so I'm going to order an MRI for him. Next patient was a patient, a 56-year-old. She had a bursa on the right fifth met head. We did a cortisone injection, made it better for a little bit, then it came right back. And I had good success with another patient. He was actually a roller skater, and he loved to roller skate. He had a huge bursa, and I did Shockwave for him, and it really calmed everything down and caused everything to get better. So I'm going to do 6 sessions of Shockwave on that patient. She's going to schedule that. Next patient was a 61-year-old. She had nail fungus. So I in this one, and I tend to recommend patients, like, we can do a nail sample and I can see you back in 2 or 3 weeks, or we can save time and just go right into the treatment. And I'm getting more patients, they just want to get started with the treatment. So I did do LFTs, I did the prescription, and then the fungal kit for this patient. And so what I tend to explain to them is I say, well, if it doesn't work, when I see you back in 3 months, I'm not seeing that proximal clearing in the nail, then we can do a nail sample at that time, or we can switch the medication. But a lot of patients, they like speed to treatment. Next patient was an ulcer. He has an IPJ ulcer, debrided it. It's funny, this one here, originally we did collagen in the office, and then the insurance wouldn't cover our collagen. So, once again, Amazon, he found collagen online, and he's like, is this the same as the Amerix collagen? And I'm like, I don't know. I don't know, every collagen is different, but he bought it online for a lot less expensive. So I'm thinking there's this trend, and I've had even a patient the other day that bought their cam boot online. So there's a lot more people, I think, buying things online with these higher deductible plans that we're seeing in the office. And then the last patient of the day, was a gentleman, 59-year-old gentleman. He had severe plantar fasciitis. He had been treated by another doctor in a nearby town. He had orthotics from him. And I spent a lot of time with him. He is a local doc, and he has equinus, once again bilaterally, so he's going to do in the night splint, foam rolling, morning stretch thing. And I showed him on his ultrasound. He did have thickness of the fascia on that right side compared to the left side, and I really kind of explained to him, like, he was like, do I need new orthotics? Well, his orthotics, they were old, but I don't think that's the cause of his heel pain. I don't think new orthotics are going to take care of everything, so I didn't do that. He went back to see a new doctor that bought this other gentleman's practice, and they just put him in some power steps, and so he didn't feel as good with the power steps. He felt better with the more structured carbon fiber orthotic that he had before, and I think that's better, right? His shoes were okay. He had the tightness, so I was just reinforced, the use of the whole morning routine, foam rolling, morning stretch, and sometime doing the night splint and UFOs around the house. But ultimately, I think he is going to be best suited with Shockwave for this condition. Now, with patients, he asked me, well, what would you do? I said, I would do Shockwave. Like, the other option, so he's a busy doctor, so you can either come in 6 times for the Shockwave, or you can go twice a week for 6 weeks for physical therapy and potentially not get better, and then you have to do the Shockwave afterwards. So in his case, it's probably better to do the Shockwave, and so that's what I recommended for him. So we'll see kind of what he decides. But whenever patients ask me, I do recommend Shockwave because I just think it works so well, and I think there's a high recovery rate, and I think he will do better as long as he works on the Aquinas as well. So that was the day. So if you have patients buying things on Amazon, I'd love to hear how you get around that. I'd love to hear your thoughts. Shoot me an email or Don at podiatrypracticemastery.com. Let me know kind of what's working on your practice. If you want, I have a kind of a practice analyzer on that website as well, podiatrypracticemastery.com, where you can it goes through the structured here, all the things I use in my practice to get to the $1 million mark. Okay, hope this is beneficial. Have a great one.